to temporarily halt certain amounts of Medicaid funding that are going to the state of Minnesota in order to ensure that the state of Minnesota takes its obligations seriously to be good stewards of the American people's tax money.
It's going to be $259 million of deferred payments for Medicaid to Minnesota, which we're announcing as I speak to Governor Walz and his team.
Vice President J.D. Vance's nationwide fraud crackdown is kicking off in a familiar place, Minnesota. But he says illegal immigrants on Medicaid and fraudulent daycares are just the start. He believes that the federal government wastes $300 billion per year.
Okay, so let's talk about what just happened in Minnesota, because this story is being sold to the American public as a straightforward fraud crackdown, a win for taxpayers, a victory for accountability. Doge 2.0, they are calling it on Fox News. And here's the thing. Medicaid fraud is real. Nobody serious disputes that. There are documented cases. There have been convictions. People have gone to jail. The fraud exists. But what the Trump administration just did in Minnesota is not simply a fraud investigation. It is a $259 million funding freeze, announced without a court order, without a completed investigation, without due process, applied to an entire state's Medicaid program while real patients, real children, real elderly Americans who have nothing to do with any fraud are waiting to find out if their health care coverage is still active. And if you watch the Fox News coverage of this announcement, if you saw what the hosts were actually saying on camera, you saw something that should alarm every American regardless of their politics, because they were not talking about fraud investigations. They were talking about Somalis, about Ilhan Omar, about illegal migrants, about draining the swamp. That is not a fraud crackdown. That is a political targeting operation dressed up as fiscal responsibility. And the people who are going to pay the price are not the fraudsters. They are the vulnerable Americans who depend on Medicaid to survive. But before we go any further, real quick, let's be honest. You can't really trust mainstream media anymore. That's why we built Pump Politics, to bring you real stories, real context, and no corporate spin. If you want to stay ahead of the headlines, join our free newsletter. We'll send the news straight to your inbox every day. Just click the link in the description to join. And if you just want to support what we're doing, join us. Be part of the community that actually cares about the truth. All right, let's get back to the video. Let's start with what actually happened, because the details matter enormously here. The Trump administration announced it is temporarily halting $259 million in Medicaid funding to Minnesota. The stated reason is to ensure the state takes its obligations seriously to be good stewards of American taxpayer money. The announcement was made by a federal official while simultaneously being communicated to Governor Tim Walz's team. Dr. Mehmet Oz, who Trump appointed to oversee Medicare and Medicaid, is described as keeping numbers on both programs. The Justice Department is involved. The Vice President's office is involved. And the administration is framing this as a major fraud crackdown with convictions already secured and more prosecutions coming. Here is what is true about all of that. Minnesota did have a significant Medicaid fraud scandal involving fraudulent daycare centers. It was real. It was serious. Federal and state prosecutors have pursued cases. Convictions have happened. The fraud was documented and it was significant. But here is what the administration is not telling you. The investigation into that fraud is already underway through normal law enforcement channels. The Justice Department was already prosecuting those cases. The system was already working. A $259 million funding freeze applied to the entire state Medicaid program is not a fraud investigation tool. It is a political pressure tactic. It is the federal government using healthcare funding for vulnerable Americans as a lever to extract political compliance from a Democratic governor in a state that is home to the most prominent Muslim congresswoman in American history. Those two things are not the same, and conflating them is exactly what the Trump administration wants you to do. Now let's talk about the Fox News coverage of this announcement, because it accidentally told you everything you need to know about what this is really about. When the hosts and commentators on Fox News started discussing this funding freeze, they did not spend their time talking about fraudulent daycare operators or specific criminal cases or the mechanics of Medicaid oversight. They talked about Somalis. They talked about Ilhan Omar throwing what they described as F-bombs, They talked about illegal migrants being on Medicaid rolls. They talked about draining the swamp. One host literally described it as shooting fish in a barrel. That is the tell. That is the moment where the mask slips, and you see what this is actually about. Because if this were genuinely about Medicaid fraud, the conversation would be about specific documented fraud cases, about the prosecutions already underway, about the oversight mechanisms being strengthened, about how the funding freeze targets the fraudulent actors rather than the vulnerable patients who depend on the program. Instead, the conversation on the network that serves as the unofficial communications arm of the Trump administration was immediately about ethnic minorities, about a Democratic congresswoman, about immigration, about political enemies. That is not how you talk about a fraud investigation. That is how you talk about a political targeting operation. And the people who will suffer the consequences while the political targeting is happening are not the fraudsters. They are the children, the elderly, the disabled Americans in Minnesota who depend on Medicaid for their health care and who have done absolutely nothing wrong. Let's zoom out for a moment because this Minnesota Medicaid freeze does not exist in isolation. It is part of a pattern that has been building since the beginning of Trump's second term. The Trump administration has consistently used federal funding as a political weapon against Democratic states and Democratic-leaning cities, threatening to withhold funding from sanctuary cities, freezing grants to universities that host protests, conditioning federal dollars on political compliance with administration priorities. The Minnesota Medicaid freeze fits perfectly into that pattern. And the choice of Minnesota is not random. Minnesota is home to Ilhan Omar, one of Trump's most prominent Democratic critics. It has a large Somali American community that Republican media has been targeting for years. It has a Democratic governor who was Kamala Harris's running mate. And it had a real documented fraud scandal that gives the administration a politically convenient hook to justify what is fundamentally a political action. The fraud justification is real enough to be defensible. The political targeting is obvious enough to be unmistakable. And the combination of the two is exactly how this administration has operated throughout its time in office. Find a legitimate-sounding reason to do something that is actually about punishing political opponents and rewarding political allies. Meanwhile, the actual consequences of a $259 million funding freeze fall not on politicians, not on fraudsters, not on anyone the administration is actually targeting politically. They fall on Medicaid recipients, on families, on children, on elderly people in nursing homes, on disabled Americans who have no other source of health care coverage, who had nothing to do with the fraud, who are not illegal migrants, who are not political opponents of anyone, who are simply Americans who depend on a program that the federal government just froze for political reasons. Okay, so let's break this down into the 4 things that actually matter here, because there is a lot happening beneath the surface of this story. Point number 1, Medicaid fraud is real, but a funding freeze is not a fraud investigation tool, and the difference matters enormously. Documented Medicaid fraud in Minnesota is real. Prosecutions are real. Convictions are real. Nobody is disputing that. But a $259 million funding freeze applied to an entire state program is not how you fight fraud. Fraud investigations target specific actors. They use law enforcement tools. They prosecute individuals. They do not freeze funding for an entire program that serves hundreds of thousands of legitimate recipients, while investigators work through specific cases. If the goal were genuinely to stop fraud, the tool would be targeted law enforcement action, which was already happening. The goal of a statewide funding freeze is not to stop fraud. It is to put political pressure on a Democratic governor by threatening the health care of his constituents. Point number 2, the Fox News coverage revealed the real political motivation in real time. When the network that speaks for this administration immediately pivots from fraud to Somalis, to Ilhan Omar, to illegal migrants, to draining the swamp, that tells you what the actual political calculation is. This is about using a legitimate fraud issue as a vehicle for advancing an anti-immigration, anti-democratic political narrative aimed at a state that represents everything Trump's base has been told to resent. That is not governance. That is not accountability. That is political performance using vulnerable people's health care as the stage. Point number 3. The people who will actually suffer from this funding freeze are not the people being targeted politically. This is the most important point, and it is almost entirely absent from the coverage. The fraudsters who ran the fake daycare schemes are already being prosecuted. Some are already in prison. The $259 million funding freeze does not hurt them. It does not accelerate their prosecution. It does not recover stolen money. What it does is create uncertainty and potential gaps in healthcare coverage for the legitimate Medicaid recipients in Minnesota, for children from low-income families, for elderly people in long-term care facilities, for disabled Americans whose medical needs do not pause because a federal funding freeze is being used as a political bargaining chip. Those people are the collateral damage of a political targeting operation, and they deserve better than to be used as leverage in a fight between the Trump administration and a Democratic governor. Point number 4. This is part of a systematic pattern of using federal funding as a political weapon against Democratic states, and that pattern has serious long-term consequences for American governance. When the federal government conditions Medicaid funding on political compliance, when it uses healthcare dollars as leverage against governors who criticize the president, when it frames ethnic and immigration rhetoric as fiscal responsibility, it is doing something that goes far beyond any individual fraud investigation. It is establishing a precedent that federal funding is not a legal obligation administered by neutral institutions, but a political tool wielded by whoever controls the White House. That precedent does not disappear when the party in power changes. It becomes available to every future administration. It turns federal funding into a weapon that can be aimed at any state, any city, any population that a future president decides to target. The long-term damage to American governance from that precedent is far greater than any amount of Medicaid fraud that this administration will ever actually recover. So here is the bottom line. The Trump administration froze $259 million in Medicaid funding to Minnesota. The stated reason is Medicaid fraud, which is real and which is already being prosecuted through normal law enforcement channels. The actual mechanism, a statewide funding freeze rather than targeted law enforcement action, is a political pressure tactic, not a fraud investigation tool. The Fox News coverage of the announcement immediately revealed the real political motivation: Somalis, Ilhan Omar, illegal migrants, draining the swamp. That is not the language of a fraud crackdown. That is the language of political targeting. The people who will suffer the consequences of this funding freeze are not the fraudsters, who are already in the criminal justice system. They are the legitimate Medicaid recipients in Minnesota: children, elderly people, disabled Americans who have done nothing wrong and who are being used as political leverage in a fight between the Trump administration and a Democratic governor. Medicaid fraud is a real problem that deserves real solutions. Targeted prosecution, strengthened oversight, better verification systems. Those things were already happening in Minnesota before this announcement. What was not happening was a $259 million statewide funding freeze announced on Fox News with ethnic and immigration rhetoric as the backdrop. That is not a solution to fraud. That is a political operation. And the vulnerable Americans caught in the middle of it deserve a government that fights fraud with law enforcement tools instead of fighting Democrats with their constituents' health care. Stay tuned, because this is not the last state that is going to face this kind of political pressure, and the pattern that is being established right now is going to define how federal funding works in America for years to come.